Welcome back to Women's Health Weekly. We're here broadcasting from New York City on YouTube with Dr. Carol Long-Roche from Memorial Sloan Kettering Cancer Center, who we're very excited to have. Please don't forget to subscribe to our YouTube channel, look for our podcast and our short videos that will come after this with some very, very specific topics that we're discussing. Okay, so I'm going to ask the corollary question, which is how can I prevent myself, if I'm a woman, how can I prevent myself from getting HPV?
Outside of limiting sexual partners or encounters or monogamous relationships, there is really no surefire, and even that's not surefire way, because even if your monogamous partner has HPV, it can be transmitted. So we really don't focus as much on the prevention in terms of activity. What we do focus on is vaccination. And so we do have a vaccine against HPV. And to me, as a cancer doctor, this is just the most exciting thing, because this is essentially an anti-cancer vaccine. And if both men and women are vaccinated against HPV, that can actually prevent the transmission if someone is exposed.
Who should get an HPV vaccination? And if there's a particular type of person who should get it, how old? When does that occur? How does that work?
In the United States, we recommend that boys and girls around age 11 or 12 be offered the HPV vaccine. It's understandable that people are concerned. I'm a parent, and so I understand it's hard to, give anything to your healthy child, but this is actually one of those things that really can protect their life and their fertility and all sorts of things. So that's the first place. But if a person hasn't received the vaccine as a child, it's something that they can talk to their gynecologist about. The current guidelines cover HPV vaccination up to age 45, but there's really no reason why it couldn't be considered outside of that for select patients. And in my practice, we really offer it to anyone who would like it. It is a safe vaccine. There are always anecdotes of people who have had bad experiences, and I acknowledge that and empathize with the fear that comes from that. But the scientific data supports that other than some transient, soreness in the arm or some mild symptoms, that it's very safe.
HPV is a virus, and as such, it's an infection. So are there things that women can do to take care of themselves, to give themselves, so to speak, in quotes, a healthy immune system, and potentially prevent it from infecting them, even if they are exposed?
You can do everything right and still have dysplasia. You can be super healthy with a robust immune system and still have dysplasia and cervical cancer. And you can do everything wrong and not have it. So there are some things that are out of our control. However, with that said, healthy lifestyle and decreasing some known risk factors are really important. So one thing is smoking. We know that if a patient has HPV and they are a smoker, that they are much more likely to have precancer and cancer. So smoking is a big thing. Things that are another big thing is the vaccine. So we all have, that's something that we can all do. And actually in our clinic, we all gave each other the vaccine when the age guidelines changed. So we all got it together here in my clinic. The other things are a little less data driven, but I think most of us believe in them, which is things like stress reduction. So getting a good amount of sleep and eating a healthy diet, focusing on whole foods and trying to limit, things that are common sense would tell you are unhealthy. Even women who have had dysplasia, there's now some evidence that getting the vaccine will prevent that dysplasia from coming back. And then there are some holistic things that have actually been studied in a pretty rigorous way. There is a mushroom extract supplement that data was recently presented at our 2019 Society for Gynecologic Oncology meeting, that it decreased the recurrence of cervical related problems. So that would be my suggestions. Don't smoke, see your gynecologist, get your vaccines, and then of course, general healthy lifestyle, exercise, good sleep, healthy diet.